Your body burns oxygen right now, every second. Blood carries it like fuel. Cut the fuel, the engine dies, fast. Doctors watch one number above all else: oxygen saturation. Normal, 95 to 100. Below 90, the alarm fires. Below 80, the body shuts down. The brain feels the drop first. Thoughts go soft, vision darkens at the edges, fingers go cold. The body pulls blood inward, protecting the core. Red blood cells carry oxygen like cargo ships. Too little oxygen, too few ships. The cells scream for fuel. The organs start rationing. Some get cut off entirely. At 85%, the heart pumps harder, faster, more blood, more oxygen. It works double time. It cannot last. At 80%, confusion hits. The patient can't answer. Words come out broken. The brain is starving. The lungs pull harder. The chest heaves. Rib muscles strain. Neck muscles tighten. The body uses everything it has. Everything. Watch the skin. Lips turn blue. Fingernails lose their pink. Doctors call this cyanosis. Oxygen has left the outer tissues. First weapon, oxygen flow. A mask seals over the face. Pure oxygen floods in. The number climbs. But sometimes the lungs won't take it. They're too damaged. Fluid can fill the air sacs. Pneumonia does this. Heart failure does this. The oxygen can't cross into the blood. It just sits in the flood. Below 70%, organs begin to fail. Kidneys slow down. Liver stops filtering. The heart fires irregular rhythms. Every second costs something permanent. When the mask fails, a tube goes in, straight down the throat, into the airway. A machine breathes for the patient, completely, mechanically. The ventilator pushes air in, then pulls it out, over and over. It controls the oxygen. It controls the pressure. It keeps the lungs from folding. The brain survives 4 minutes without oxygen. After that, cells die. Not sleep, not pause. Die permanently. 4 minutes is the hard wall. In the ICU, every breath is measured. Oxygen, carbon dioxide, heart rate, blood pressure. The machines never stop watching, never stop logging. What causes a fast drop? Airway blockage, food, a clot, swelling from an allergic reaction. The pipe seals shut. Lung collapse. Air leaks into the chest cavity. The lung folds like a flat balloon. Breathing happens, but no oxygen crosses into the blood. Heart failure floods the lungs. The pump weakens. Blood backs up. Fluid pours into the air sacs. The patient drowns in their own fluids. High altitude cuts oxygen fast. Thin air, less oxygen per breath. The body breathes faster. Heart races, but it's never enough. The pulse oximeter is a small clip. It reads blood color through the fingertip. Bright red is oxygenated. Dark purple is not. The machine reads the difference. 95 to 100 is normal. 91 to 94, watch closely. 86 to 90, act now. Below 85, crisis. Below 70, catastrophic. When oxygen drops, the body compensates. Faster breathing, harder pumping. Blood reroutes to vital organs. This phase can last minutes. Then it collapses. Decompensation is when the body quits. Blood pressure crashes. Heart rhythm breaks apart. Breathing goes shallow. This is the crash point. You've seen the drop. You've seen the fight. Now you'll see what the team does. In the first 60 seconds, when the alarm fires, the rapid response team runs. 90 seconds to arrival. 30 seconds to assess. Airway, breathing, circulation. 3 checks, 3 seconds each. First line, nasal cannula. Small prongs in the nostrils, low flow oxygen. If that fails, face mask. Higher flow, more oxygen per breath. If the mask fails, non-rebreather goes on. Tight seal. Reservoir bag. Pure oxygen every breath. 90% concentration. Near maximum without a machine. Sit the patient upright. Gravity opens the lungs. Lying flat compresses them. Even this change moves the number up. Bronchodilators blast open constricted airways. 60 seconds. Airways widen. More oxygen floods in. More carbon dioxide blasts out. Steroids reduce swelling in the airway lining. They work slower, but they hold longer. One drug acts fast. One drug holds the gain. The intubation decision comes fast. The patient can't protect their airway, can't hold their saturation. The tube goes in. The machine takes over. A scope opens the view. The back of the throat appears. The tube slides past the cords. A balloon inflates. Airway sealed and secured. The ventilator gets set. Tidal volume, rate, oxygen concentration, pressure limits. Precision no human lung can match. After intubation, chest X-ray. Tube must sit above the carina. Too deep, one lung gets no air. One X-ray, one confirmation. Forward, the patient moves to the ICU. Continuous monitoring. Arterial line. Central line. The room becomes a system, working in concert. The arterial blood gas test reads blood directly. Oxygen, carbon dioxide, blood acidity. 3 numbers tell the complete story of what the lungs are doing. If oxygen climbs back above 90, the team pulls back slowly, reduces concentration, lets the lungs relearn, lets the patient start doing work again. Weaning off the ventilator is slow. The machine does less. The patient does more. Spontaneous breathing trials. 30 minutes without support. Try, watch, measure. Too much pressure ruptures air sacs. Too much oxygen damages lung tissue. The cure can injure if misused. If the drop lasted too long, damage remains. Brain cells lost, kidney function reduced, heart muscle stressed. Recovery takes weeks, sometimes never returns. How do you catch it before the crash? Continuous monitoring. Pulse ox on every high-risk patient. Alarm set at 93. Catch it at the edge. Watch the patient breathe. Accessory muscles pulling. Nostrils flaring. The body fights before the numbers crash. Visual cues matter as much as data. The patient stabilized after 48 hours. Ventilator weaned over 72 more. Walked out on day 7. Oxygen never hit 100 again. But 94 was enough to live. If someone you love is in the ICU, I put together a free ICU first 24 hours checklist to help you know what questions to ask, what information matters most, and what to expect during those first overwhelming days. You can download it using the link below. Subscribe to Telemetry Blue. And next time, we're diving into one of the most feared words in medicine: sepsis. What happens when your body's attempt to save you starts causing damage of its own?